IGF-1 in bodybuilding, the growth factor explained. Introduction. If HGH is the spark, IGF-1 is the fire. When bodybuilders inject HGH, much of its power comes from one thing: insulin-like growth factor 1, or IGF-1. This hormone is the real anabolic workhorse, driving muscle growth, cell repair, and recovery. But IGF-1 is a double-edged sword. It can build incredible physiques, or it can cause serious health problems. Let's break it all down. What is IGF-1? Full name: Insulin-like growth factor 1. Structure: small peptide hormone, very similar to insulin. Produced in the body, mainly in the liver after stimulation by HGH. Also produced locally in muscles, bones, and other tissues. Natural roles: stimulates cell growth and division, drives muscle hypertrophy and repair, promotes bone and connective tissue growth, regulates metabolism and insulin sensitivity. Key fact: HGH itself does little directly for muscle growth. It works by stimulating IGF-1 production. Why bodybuilders use IGF-1? Muscle growth, direct effect. IGF-1 stimulates satellite cells, or muscle stem cells. Leads to new muscle fiber growth, not just bigger cells, but more cells. Hyperplasia versus hypertrophy. Steroids mainly cause hypertrophy. Existing fibers get bigger. IGF-1 may cause hyperplasia, increase in number of fibers. This is why it's called the holy grail of muscle growth. Local effect, or site enhancement. Injected IGF-1 into a specific muscle, like biceps, delts. Local growth. Popular in pro bodybuilding for weak points. Synergy with HGH and insulin. HGH stimulates IGF-1. Insulin plus IGF-1 equals nutrient shuttling, glycogen storage, massive pumps. Together, they create the 3D granite look. Fat loss support. IGF-1 improves insulin sensitivity. Helps body use carbs more effectively, reducing fat storage. Forms of IGF-1. IGF-1 LR3, long ARG3 IGF-1. Modified version with longer half-life of 20 to 30 hours. Remains active in the body much longer than natural IGF-1. Widely used in bodybuilding. IGF-1 DES 1 to 3. Very short half-life, about 20 to 30 minutes. More powerful locally at the injection site. Used for targeted growth. Recombinant IGF-1, Increlex. Medical version for growth disorders. Rarely used in bodybuilding due to availability. Dosage and administration. Educational only, not recommendations. IGF-1 LR3, 20 to 40 micrograms per day, often post-workout. Sometimes cycled 4 to 6 weeks. IGF-1 DES, 20 to 60 micrograms injected directly into the trained muscle. Taken immediately post-workout for localized effect. Stacking, always combined with HGH, testosterone, and often insulin. Rarely used alone, less effective without synergy. Benefits of IGF-1. Muscle hyperplasia. Potential creation of new fibers. Site-specific growth. Weak point muscles can be targeted. Recovery. Enhances repair of tendons, joints, and ligaments. Synergy with insulin and HGH. Maximizes nutrient partitioning. Recomposition. Leaner, fuller look. Longevity of gains. Some claim IGF-1 hyperplasia makes gains more permanent than steroids alone. Side effects and risks. Short-term. Hypoglycemia. IGF-1 acts like insulin. lowers blood sugar, can cause dizziness, sweating, even unconsciousness, water retention and bloating, joint and muscle pain, long-term high dose, organ growth like HGH, heart, liver, intestines, distended GH gut, cancer risk. IGF-1 promotes cell division, may accelerate tumor growth. Diabetes. Chronic use can disrupt insulin sensitivity. Acromegaly-like changes. If combined with high HGH, enlarged hands, jaw, and feet. Popular stacks with IGF-1. HGH plus IGF-1. The natural partnership. HGH stimulates IGF-1. Injecting both boosts levels further. HGH plus IGF-1 plus testosterone. Test provides mass. HGH plus IGF-1 refine and polish physique. Classic off-season and pre-contest stack. HGH plus IGF-1 plus insulin. Maximum anabolic environment. Dangerous, requires perfect diet and monitoring. Used only by advanced or pro bodybuilders. Harm reduction. Cycle length. Short cycles, 4 to 6 weeks, to avoid organ growth. Blood work. Fasting glucose, HbA1c, IGF-1 serum levels. Nutrition. Carb timing essential to prevent hypoglycemia. Balanced diet with low sugar. Monitor symptoms. Numbness, bloating, swelling, stop, or reduce dose. Medical screening. Cancer checks before and during use, very important. Science versus hype. True, IGF-1 promotes muscle growth beyond steroids alone, can cause site-specific growth, improves recovery. Exaggerated. IGF-1 will make you huge in weeks, not with HGH, testosterone, insulin, and diet. Safe anti-aging peptide. Long-term risks are real and serious. Conclusion. IGF-1 is the anabolic hammer that HGH swings. It may create new muscle fibers, giving bodybuilders a physique beyond natural limits. But this power comes with danger, hypoglycemia, organ growth, and even cancer risk. IGF-1 works best in synergy with HGH, insulin, and testosterone. But it's a stack only the most extreme athletes dare to use. For most, it's not the holy grail. It's the double-edged sword of growth.